Understanding your baby's feeding duration can be a source of concern for many new parents. Knowing what is normal can help you feel more confident and ensure that your baby is getting the nourishment they need. Here's a step-by-step guide to help you understand your baby's feeding duration. Step 1. Know the typical feeding duration for newborns. 1. Expect longer feeding sessions. Initially, newborns feed frequently. In the first few weeks, newborns typically feed every 2-3 hours, with each session lasting anywhere from 20 to 45 minutes. Both sides of the breast. If you're breastfeeding, allow your baby to feed from both breasts during each session to ensure they are getting enough foremilk and hindmilk. 2. Understand growth spurts. Expect increased feeding. During growth spurts, at certain points, usually around 2-3 weeks, 6 weeks, and 3 months, your baby may experience growth spurts and want to feed more often and for longer durations. This is normal. These periods of frequent feeding are normal and help increase your milk supply to meet your baby's growing needs. Step 2. Pay attention to your baby's hunger cues. 1. Recognize early hunger cues. Watch for rooting. Your baby may turn their head toward your breast, open their mouth, or start sucking on their hands when they're hungry. Fussiness or crying. If you miss the earlier cues, your baby may start fussing or crying. Try to respond to hunger cues before they start crying to make feeding more comfortable. 2. Feed on demand. Don't focus too much on the clock. Instead of sticking to a strict feeding schedule, offer the breast or bottle whenever your baby shows signs of hunger. Allow your baby to set the pace. Your baby may take longer during some feedings and shorter during others. Let them feed until they're satisfied. Step 3. Understand how feeding duration changes over time. 1. Expect shorter feedings as your baby grows. Increased efficiency. As your baby grows, they'll become more efficient at breastfeeding or bottle feeding, which may reduce feeding times. Typical time frame. By around 3 to 4 months, feeding sessions may become shorter, lasting about 10 to 20 minutes per session. 2. Recognize changes in appetite. Appetite may fluctuate. As your baby grows, their appetite may change due to teething, illness, or developmental milestones. Be flexible and adjust as needed. Don't worry about short sessions. If your baby is feeding for a shorter duration but seems content, has good diaper output, and is gaining weight, they're likely getting enough milk. Step 4. Monitor diaper output and weight gain. Count wet and dirty diapers. Wet diapers. Expect at least 6-8 wet diapers a day. This is a good sign that your baby is getting enough fluids. Dirty diapers. In the early weeks, your baby should have at least 3 to 4 dirty diapers a day. The frequency may decrease as they grow older. 2. Track weight gain. Regular checkups. Ensure that your baby is gaining weight according to their pediatrician's recommendations. Regular checkups will help track their growth. Don't obsess over the scale. While weight gain is important, focus more on your baby's overall well-being and happiness. Step 5. Address feeding issues promptly. 1. Identify signs of feeding problems. Poor latch or sucking. If your baby is having difficulty latching or sucking, they may not be feeding efficiently, which can lead to longer or more frequent feeding sessions. Seek professional help. If you suspect feeding problems, consult a lactation consultant or pediatrician for guidance. 2. Avoid overfeeding. Watch for fullness cues. If your baby turns away from the breast or bottle, or seems uninterested in feeding, they may be full. Don't force feed. Respect your baby's signals and avoid pushing them to continue feeding if they seem satisfied. Step 6. Don't compare feeding durations. 1. Every baby is different. Normal variations. Understand that feeding durations can vary widely from one baby to another. What's normal for one baby may not be for another. Focus on your baby's needs. Rather than comparing with other babies, pay attention to your baby's unique feeding patterns and needs. 2. Consult healthcare providers. Ask for reassurance. If you're concerned about your baby's feeding duration, don't hesitate to consult your pediatrician or a lactation consultant for reassurance and advice. Stay informed. Keep learning about breastfeeding or formula feeding to better understand your baby's needs and what's normal for them. Final tips. Be patient. Feeding sessions can sometimes feel long, especially in the early days. Try to relax and enjoy the bonding time with your baby. Create a comfortable feeding environment. Make sure you're in a comfortable setting, whether you're breastfeeding or bottle feeding. to help both you and your baby feel at ease. Trust your instincts. You know your baby best. Trust your instincts when it comes to feeding duration and seek help if something doesn't feel right. By understanding your baby's feeding duration and what's normal, you can help ensure that they are well-nourished and thriving. Remember that every baby is different, and it's important to follow your baby's cues and consult with healthcare providers as needed.